What are common sleep disorders? At least 40 million Americans each year suffer from long-term sleep disorders. Another 20 million people sometimes have trouble sleeping. The most common sleep disorders include insomnia, sleep apnea, restless leg syndrome, and narcolepsy. Inability to sleep. Almost everyone has short-term insomnia, which can be the result of stress, diet, jet lag, or other factors. Insomnia almost always affects a person's work performance and overall well-being. This problem increases with age and at some point affects about 30% of men and 40% of women. Your doctor may prescribe sleeping pills to treat short-term causes of insomnia. Hypnotics are generally not considered effective in the long run because they stop working a few weeks after night use. Also, long-term use can interfere with sleep. For more severe or long-term insomnia, researchers are looking at other approaches, such as using bright light, phototherapy, to alter the circadian rhythm. 1. Sleep apnea. According to the American Sleep Foundation, NSF, about 18 million Americans have sleep apnea, but few have been diagnosed. People with this disease hold their breath while sleeping. Physical changes, such as changes in fat accumulation or loss of muscle tone due to aging, can cause sleep apnea. Typical features of this disorder include large snoring, obesity, and excessive daytime sleepiness. Sleep apnea is associated with large snoring, but not everyone who snores has sleep apnea. To diagnose sleep apnea, you need to observe people during sleep and record measurements of some physical functions and activities during sleep. Sleep polymorphism is a record of a person's sleep patterns, breathing, and cardiac activity. Sleep polygraphy is obtained through sleep tests and can diagnose sleep apnea. This test can diagnose sleep apnea by recording a person's brain waves, heart rate, and breathing overnight. Treatment for sleep apnea includes losing weight and preventing people from sleeping on their backs. Another option is to use a special device or perform surgery to correct airway obstruction. 1. Restless leg syndrome, RLS. According to the National Institute of Neurological Disorders and Stroke, NINDS, up to 10% of Americans can have RLS. 1. This disease tends to occur within the family and causes itching, tingling, or an unpleasant sensation of crawling under the legs and feet, requiring movement of the feet and legs for relief. People with RLS can constantly move their legs during the day and at night, which can lead to sleep disturbances. Symptoms of RLS can occur at any age, but the most severe cases usually occur in older people. Many patients with RLS have a disorder called periodic limb movement disorder, PLMD, which causes repetitive spasms of the limbs, especially the legs. Movement occurs every 20 to 40 seconds and can wake up at night. The treatments indicated for RLS and PLMD include drugs that affect the neurotransmitter dopamine. However, since RLS and PLMD are not well understood, it is also not well known why drugs that affect dopamine levels in the brain are helpful. 1. Narcolepsy. About 0.02% to 0.067% of Americans have narcolepsy. 2. People with this disease develop sleep seizures during the day even if they get enough sleep the previous night. Sleep seizures can last from a few seconds to more than 30 minutes. In addition to falling asleep at unexpected times, people with narcolepsy may lose control of their muscles in emotional situations or experience hallucinations, temporary paralysis, and sleep disturbances at night. Narcolepsy tends to occur in families with a history of sleep disturbances, and it also affects some people with head injuries or trauma. Once diagnosed, narcolepsy can be treated with medications that control symptoms. Drugs commonly prescribed for this condition include stimulants and antidepressants. Because each case is different, the most effective drugs are different from person to person. Thank you for watching. Please do subscribe so that you don't miss my future videos.